Welcome to GTAS Box. Happy evening to everyone. So we are gathered today. Today is our occasion of medical coding, national medical coding. So thanks for joining this pleasant evening. So what is meant by medical coding? So a simple terminology, medical coding is the conversion of sign and symptoms and diagnosis. What the professional surgeons means what they are doing the surgeries, all those things are converted into the alphanumerical terminology. A simple word, diagnosis, surgeries, that is equal to alphanumeric terminology. That is the medical coding. So where this medical coding is applicable? This medical coding is applicable in the hospitals, mainly hospitals, which is linked to the laboratories. So where the hospitals, the patients, surgeons and health insurance company. So these three combinations, that is equal to medical coding. In this medical coding, so we can learn numerous of departments like evaluation department, surgery department, outpatient, inpatient. Nowadays we are having a global rich growth of inpatient coding. So what are the steps involved in the RCM? What is meant by RCM? RCM is a revenue cycle management. For every revenue cycle management, we are having a numerous number of steps. In this revenue cycle management, we are having the pre-registration. So who can do the pre-registration? The person who is sick or abnormal state, the person will come to the hospital. Before coming to the hospital, they should register in the demographic registration. So the demographic registration means the patient name, what is the gender, what is the age, all those things comes under the demographic registration. So next, registration. For every patient in hospital, they will give the account number, that is a MRN number. So with the MRN number, the MRN number is useful for each sequence of each sequence of visits in the hospital. So next, consultation. So once the patient is coming with a sign and symptom, they will consult the doctor. So here the doctor is equal to surgeon. So before going to any treatment, they will consult the surgeon and they will take the pre-appointment. Once the appointment completed, they will go for the prayer studies. Next, what is the meaning of coding and pre-authorization? Once the surgeon or physician confirm the what is meant by diagnosis, what is the patient affecting with the diagnosis, they will confirm with the diagnosis. According to the diagnosis, the physician will do the surgery. So the surgeries or the diagnosis surgeries will convert into the coding. Before coding, they will go with the pre-authorization. So what is meant by pre-authorization means for this surgery, how much amount is eligible. That will be confirmed with the pre-authorization. So once the pre-authorization completed, the surgeon will do the surgeries. So for example, if you have the patient is having the tooth pain or which is comes under the dental appliance. So once the patient comes with the tooth pain, the surgeon will give the medical treatment. If the medical treatment is also not cured, the surgeon will go for the surgeries. For example, X is the patient who is suffering with the tooth pain. So tooth pain, the tooth which is gum with the below the gums. If the gum is get swelled, the gum will be treated with any medicament. If they even clear the treatment also, if it is not cured, that it will be go with the root canal treatment. So for this root canal, the surgeon will pay for some amount. This sum amount is paid by the insurance company. So once the insurance company confirmed with the authorization, this much amount is happened, the coding will be started. Once the coding will be completed, they go for the billing. So how much amount will be paid for the tooth appliance and how much amount will be go for the surgery. So both are comes under the billing. Once the billing is completed, they go for the next section, charge. So charge capture. Once the charge capture is happened, based upon the insurance, they will go for the, for example, if it is a medical insurance, there is a government insurance, they have this certain age criteria. Once the certain age criteria is built up, they go for the next collection of the patient contribution. For example, some of the insurance which is not cover the surgeries. For example, cosmetic surgeries. So which the cosmetic surgery means which enhance the beautician. Those surgeries will not covered by the insurance. These surgeries or this part will be covered by the patient. This is deductible. Next, what is meant by medical service utilization? So these insurance companies will not cover all the services. They will cover only the health related or damage related or disease related injuries only. This will be only covered with the insurance company. Once the insurance company collected all the data, it will go for the documentation. So this documentation go for the service. This documentation go for the recruitment house. This recruitment office will collect all the data and convert this data into some claims. Some of the claims will be rejected due to the age factor or due to the incorrect service of the surgeon. So all those things will be clear in the processing area. Once the processing area is covered, they go with the payment collection. So these are the various steps involved in the revenue cycle. A simple terminology in the revenue cycle is, for example, in Indian government, so in India, what we will do, the patient come to the hospital. Once the hospital reach, they go for the consultation. Once the consultation completed, they go for the surgery. Here the amount is given by the patient to the surgeon. Where in the developed countries like UK, Australia, US, all those areas, the surgeon will not take an amount direct from the patient. The insurance company will directly pay to the surgeon. This is the process involved in the developed countries. So there is a difference between the Indian government and the US government. So all the medical professionals will be work in the developed countries only. So nowadays, even in the India also, the medical coding is somewhere they are developing the medical coding areas. Next, so who are eligible for this medical coding? So the persons who are the science background, majorly paramedical courses, means nursing, BSc nursing or MSc nursing, paramedical courses like pharmacy, diploma in pharmacy, bachelor of pharmacy, master in pharmacy, even PharmD students also eligible. Not only the paramedical courses, those who are the science graduate like BSc Zoology, BSc Botany and Biotechnology. All those students are eligible for this medical coding. In this medical coding, those who are having plenty of knowledge of anatomy and physiology, they can be a rich source for this medical coding. Next, what is the trend of growth in this medical coding? So current market growth. So if you see this medical coding, so there is a starting of this medical coding from 2019. The market size is 15.2 billion. Now it is increased a more and triple area. You can see so this is the graphical representation of the medical coding. So when we take in the statistical data from the 2021, so the medical coders or recruitment for this medical coding is 15.23 billion. So in every year, this is the recruitment and the placement of these medical coders are increasing 10% for every 1 year to the another. So the target for the 2030, the medical coding will be increases double and also the growth and recruitment also increases up to the 33.15 billions. So where this medical coding is increased, why this medical coding is increased? So every humans which every living part which is affected with the diseases. So if the affected disease, they require the treatment. So this treatment is eligible to give the live production or to give the medical to give the numerical terminology or to give the surgeries or to give the consultation. All these criteria which will meet the medical coding. So what are the certification required for this medical coding? Majorly, so there is a 6 number of certification: CPC, CPP. So what is meant by CPC? Certified Professional Coder, and CPP, Certified Professional Builder. Those two certifications are important for the medical coding. Apart from this, CPPM, which is the next criteria for this medical coding, and CPMA, which is for the auditor position, and CPCO, which is the position for the manager or team lead, and CDEO, which is the position for the outsourcing projects, and CDEI, which is the position for the inpatient coding, and CPPMA, which is a certified physician practice manager, which this certification is reserved for the eligible for the surgeon, and CPMA, which is a medical auditor and auditor approved instructor. So all those certifications are eligible for the medical coding. Here we are focusing about the CPC. So CPC is a Certified Professional Coder. So this Certified Professional Coder is eligible to claim the cases, and where the cases contain the information about the patient and information about the what the surgery is going on. All these cases will be recognized by the certified coder, which is converted into the alphanumerical terminology. So what is that? So everyone will be, after completion of course, will be think about only salary. So we are having the life sciences background. So the salary will be increases very drastically, not in a sudden like IT companies. So this salary will be, nowadays there is a 6-digit salary we can be earned from the medical coding. So 6-digit salary is up to the 1 lakh we can be expect. From the starting of 25k to 1 lakh we can be expect from the medical coding basis. So this medical coding is majorly focusing about in the, even nowadays this medical coding is opportunities giving n number of areas. For example, health professionals in the hospitals, health professionals in the laboratories, health professionals in the industries, where the patients are coming, where the surgeons are alive there. So both this triangle, so health professionals, patients and insurance companies, these 3 peoples will be build the medical coding. Thank you for giving this one.